Yep, that's me. You're probably wondering how I ended up in this situation.
But before that, we're going to introduce ourselves first. Hi, I'm Blas Pachansala.
I am Chase Rinzi-Biramas.
Alginate impression material procedure for Dentulous maxillary arch impression. First step, prepare the necessary instruments and materials. Selection of correct impression tray. Next, proportioning and mixing of impression material. Use correct water-powder ratio, and it should be powder added to the water. Mix alginate in figure of 8 wiping motion. And then, loading of impression tray and impression taking. With a spatula, gather the alginate material into one mass in a bowl. Begin loading the tray from the posterior aspect of the tray, pushing the alginate alternately. Eliminate the trapped air using the tip of the end of the spatula. Press the material into the tray so that any trapped air between the tray and the alginate is released. Using a fingertip moistened with tap water, smooth the alginate material and makes a slight indentation in the surface. Setting the impression on the maxillary arch. Operator position when taking this impression should be from the side and back of the patient. This patient operator position is frequently referred to as 11 o'clock or 1 o'clock for the left-handed operators. Ask the patient to open his mouth using the index finger and the thumb or mouth mirror. Again, retract the patient's cheek and rub a small amount of alginate on the occlusal and interproximal surface of the maxillary teeth to possibly eliminate air bubbles in the impression. The impression tray and alginate material should be facing upward. Turn the tray slightly to one side, placing the tray in the patient's mouth. Insert the tray by rotating it into the mouth as previously described. Once the tray is inserted, straighten it so that the tray handle is in line with the mid-face of the patient. Begin to apply the light and even pressure upward until resistance is felt. Sit the impression tray in the posterior region and then set it towards the anterior, allowing the alginate to flow over the molars. Retract the front of the upper lip as the tray is seated. Instruct the patient to breathe through his or her nose and lean slightly forward, with head down towards the chest. This will help to minimize the gagging reflex. Set the timer according to materials, set time, and hold the tray in place until the alginate is completely set. Next step, removing the maxillary tray. With the fingers on one hand, retract the corner of the mouth to allow air to enter the vestibule. To remove the tray, grasp the tray handle with the thumb on top of the handle and the middle and index finger between a tray and opposing teeth. Break the seal and use a downward sideways flipping motion to remove the impression. Last step, post-removal procedure. After an impression procedure, ask the patient to rinse with water to remove any excess alginate. Alginate impression material procedure for Dentulous mandibular arch impression. First, prepare the necessary instrument and materials, and then selection of correct impression tray. Next, proportioning and mixing of impression material. The same procedure with mixing the maxillary arch impression. Next, filling the mandibular tray. Load the alginate material onto the spatula and place in the mandibular tray. Begin loading the tray from one, then the other facial aspect of the tray. Continue to deposit material filling the interior of the tray. Using the tip of the spatula, press the material into the tray so that any trapped air in the alginate is released. Using a fingertip, moisten with the tap water, smooth the alginate material and makes a slight indentation in the surface. Next step, setting the impression on the mandibular arch. The operator should be in the 7 o'clock position to the side and in front of the patient, or 5 o'clock for left-handed operators. Ask the patient to open his or her mouth using the index finger and the thumb of one hand. Retract the patient's cheek. Grasp the handle of the pressure tray so that the tray and alginate are facing downward. Rotate the tray into the mouth by using the front of the tray to retract the near cheek. On your free hand to retract the far cheek. Using the index finger of both hands, press the tray downward slightly and evenly over the mandibular arch until resistance is felt. The lip should lop over the front of the tray and the alginate should extend into and fill the labial periphery. Ask the patient to raise his or her tongue to the roof of the mouth and move it from the side to side. Have the patient close his mouth to relax the tongue and cheek muscles and then carry the tray in a downward direction. Instruct the patient to breathe normally through his or her nose. If gagging occurs, set the patient to the most upright position and ask the patient to lean slightly forward. Keep the tray in place until the alginate is completely set. Next, removing the mandibular tray. Use the fingers of one hand, retract the corner of the mouth to allow air to enter the vestibule. To remove the tray, place the middle and index finger under the tray handle. The thumb sits on the top of the handle and tray. Use a firm sideways lifting motion to remove the impression. Last step, post-removal procedure. After an impression procedure, ask the patient to rinse with water to remove any excess alginate.
As you can see in the video, I am going to take an impression, Edentulous impression taking using Edentulous cast. So that's the yellow one that I am holding in the video. So I'm putting now the water into the big bowl, and then I am going to scoop 2 alginate mixture. Yes, slaying. Nice. So I am putting it in the blue bowl. Plus scoop. Slay. Slaying on that part. Okay, nice. And then I am closing it. And then I am going to fit which tray is the appropriate. So I think blue is not. So let's try the yellow one. And the yellow one is the right tray for this impression taking. See? Nice. Okay. So now I am going to mix the alginate together with the water. Okay, putting the powder to the water. Nice. Okay, mixing it. So mixing it must be fast. So stir it first and then do the figure of 8 mixture. So as you can see, I am scraping it. I'm doing the infinity. I am trying to twist or rotate the bowl for an easier manipulation of the alginate. So hit the, see? The figure of 8. And then scraping it. Getting the tray. So first the other side and then followed by the other side. Then hipping. Hip. 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 Okay. Trying to get the excess and put it in the tray. And then I am getting water to make the surface fine, to clear the bubbles. Okay, putting it in the cast. Okay. Okay. So this part, you are going to wait for at least 2 minutes for the alginate to set. So we are just checking the alginate if it is properly placed. Okay. So in this part, it's so dull that I'm still waiting for a few minutes for the alginate to set. See? It looks like I am playing of something. The childish side of me is being recorded. Yeah, still waiting, still waiting, still waiting, still waiting, still waiting, still waiting. Yeah, I'm still waiting. See? I'm still waiting, guys. I'm willing to wait. Okay. Okay. So as you can see, it slowly hardens, and still I am not convinced with the thickness. I am still checking it time to time. So and now in this part, I think it already sets. So I'm just clearing the excess on the bowl, and then I am trying now to check the sides first, the back and the other side, if the alginate really sets. So I'm trying to remove it now. Okay. So I'm trying to remove it now. So I'm trying to get the sides first and the back, because I guess the alginate is separating with the tray. So this one. So I think I am having hard time removing it, but I'm trying my best not to panic. So the other side is already out from the cast, but the other side is still intact. Yes, nice. So I already remove it, and then tada! The Edentulous cast is already done. The impression taking, the maxillary and the mandibular Edentulous impression taking. Thank you guys. What's with my face? For the maxillary impression taking, we have the same procedure with the mandibular impression taking. So we have the maxillary cast, and from mixing till the end, they have the same procedure. And yeah, we're slaying, dog.